So without any further delay, I'll ask Dr. Enas to come and talk to the audience for a few minutes. And if on your way back, on the way out, if you'd like to buy this book, it's out for sale.
Thank you, Sangeeta, for the very special introduction. Mr. Chairman, ladies and gentlemen, at the very outset, let me express my deep appreciation for the leadership of GOPIO for bringing together API and CADI research together to hold this first summit, and especially for inviting me to speak on Indian heart disease, a topic so dear and near to my heart. You are going to hear me full tomorrow morning, and I am going to be very, very brief tonight. My interest in Indian heart disease began in early 70s with 4 cases of shocking heart attacks. The first 2 were fellow Indians from India in their 20s. The first one died 15 years later, awaiting a transplant. The second Indian suffered a heart attack while taking care of another person with a heart attack, and I was called back from home at middle of the night to take his call. Third one was not a doctor but in his 30s, and he was a dear friend. He was found to have inoperable heart disease, and I had the heart-wrenching experience of telling him he has less than 5 years to live, and he did die within 4 years. The fourth one was a doctor in his 40s, 1 year after a bypass surgery, and he had a massive heart attack after that, and he had so much muscle damage, he was permanently disabled despite having a second bypass surgery. Fast forward to 2010, 30 to 40 years later. In 2010, what I experienced or saw in 1970s is happening all over the world among Indians every day and at alarming rates. The government of India, its own official statistics, says that in 2020, 2.3 million Indians would be dying from heart disease compared to 410,000 in the US. This corresponds to about 6,300 people dying every day. And of these deaths, 3,100 will be below the age of 50. 1,900 a day will be below the age of 40. And yes, 900 a day will be under the age of 30. Exactly the way I saw 40 years ago. Needless to say, this is a cause of alarm and call for action. Especially when we realize that heart disease has now become the most predictable, the most preventable, and most treatable of all chronic diseases. According to the World Health Organization, we currently have the knowledge to prevent or delay the heart attack and stroke and diabetes by 80% with changes in lifestyle and medications. The proof is in the eating of the pudding. Several countries have reduced the death rate from heart disease by 60 to 80%, with the United States decreasing by 69% in the last 30 years. At the same time, in India, it has increased by 300%. In the US, it is coming down by 5 to 6% per year, whereas in India, it is increasing by 5 to 6% per year at an increasingly younger age group. How about the Indian diasporas? Actually, the high rate of heart disease was first observed among the Indian diasporas, and the news is bad, even worse. In general, death rate from heart disease among Indians is 50% to 300% higher than compatriots of other ethnic origin. But unfortunately, second and third and fourth generations, the difference between Indians and the other populations are increasing rather than decreasing. As a result, either the heart disease among Indians are increasing or decreasing at a lower rate. I'm so glad the APIO, the GOPIO, and CADI Research has come together to address this issue together. And I hope that this topic will not end by the speeches tomorrow. And I look forward to sharing the information on heart disease tomorrow. Thank you.